I am Dr. Deepa Dewan. I am a Senior Director at Cloudnine Hospital, Golf Course Road, Gurugram. If you have a chronic pelvic pain, you've been suffering it for some time, your periods have been painful, intercourse also is painful, and you have infertility. You've been trying and you haven't conceived. The doctor has done most of your checks. The eggs are okay, husband's semen is okay, and they haven't found a reason for why you haven't conceived so far. But yes, you have reported that you have a chronic pelvic pain. So we can do an evaluation of this pain, and because this could be the reason for your infertility. How could it be a reason? The chronic pelvic pain could be resulting from an infection. It could be resulting from endometriosis. So if it was an infection, it could have been picked up on a clinical examination. It could have been picked up on tests. But endometriosis might or might not get picked up on routine tests. So if you've been having problems with fertility and you have a chronic pelvic pain, a laparoscopy might be a good idea. Put in a camera through a small hole in your abdomen. That is a telescope which goes in, and the camera outside now sees what is inside. So if you have endometriosis, it will definitely get picked up on the laparoscopy. Endometriosis could be a reason for the chronic pelvic pain as well as on infertility. Why could it lead to this? So what happens in endometriosis is that when you're bleeding outside, you're also bleeding into your tummy. And because you're bleeding into your tummy, there might be adhesions which might have formed. Your tubes might be adherent onto your ovaries. The ovaries might be adherent onto the back of the uterus. It might be obliterating the pouch of Douglas. There could also be adhesions between the bowel and the uterus, the bowel and the fallopian tube. The functioning of the fallopian tube would have got hampered with this. So all this can be checked when we do a laparoscopy. These adhesions could be leading to the chronic pelvic pain that you're getting. At the same sitting, we can diagnose and we can treat the endometriosis. If you have endometriotic cysts, they can be removed. We can ablate the endometriotic spots and the adhesions can be removed. The results of a laparoscopy from chronic pelvic pain and for fertility enhancement are good. Talk to your doctor and take her advice on this.